So the next is the term of physiologic splitting of heard as a so for the um, assessment of the heart, which is heart assessment begin when asking a child if they have noticed any cardiac symptoms such as pain. So i-ask nimo ang children kung nabay gibati diri dapit siyang dughan when we assess or mga symptoms na nabay nabantayan niya. So visual inspection to see if there a point of chest where the heartbeat can be observed follows this. So this is the term of physiologic splitting as heard as a normal. Kaning lab-dab-dab is sound as long as it is associated with respirations is normally findings in splitting as always. The presence implies of difficulty with the pulmonary valve closing suggests pathology. Kung naay naka-block sa imong pulmonary valve, so probably is maglisod ka na ginhawa. So for the newborn for the newborn assessment is listen to heart sound in young children in early examinations before a child begin to cry. So because it's almost possible to evaluate heart sound and over the sounds of crying, allowing a parent to hold a child when listening to heart to help to reduce. So syempre kay infant pa man siya, so need jud og guardian or parents na moalalay sa ato as a health worker. So dapat is kanang dapat sa pag-assess ani niya is kung muhilak ang bata is the more nato na madunggan ang iyahang heart sound. So the school age and as a child and adolescent, listen carefully for the sounds of murmurs in the children of the school age and older. So particular with refers to their primary health care provider for further evaluation. So if naay problem ang imong child about sa iyang sounds sa paginhawa or about problems sa iyang heart is dapat i-refer din na nato siya sa primary health care or care provider para ma-evaluate or matagaan siya medications, then na siya mga follow-up check-ups for sa iyang problema about sa heart. So assess of abdomen that anatomically divided in 4 quadrants. That quadrants are organs that lie within them are shown. So as you can see na ang atong abdomen is naka-quadrant na siya into 4 quadrants. So unsa man ang 4 quadrants sa sa abdomen. So which is the right upper quadrant, the left upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. So as you can see that a brood of swishings or blowing sounds occurring if there an outpouching of the aorta is an example niya is aneurysm, which is a condition that can be congenital although usually with aging. So begin assessment of the farthest point of the work toward the tender area. If no tenderness presents, the older or palpate the important as long as true. So the next is what is hypopadias? The next is the so the newborn infant is a kidney may be located by the abdominal pain. So as you can see here, nakita nato na ang abdominal pain, which is na dito nakalocate ang kidney, that the right kidney is slightly lower than the left up to locate. So para madali, so dito nato siya ipalpate. So the preschool and the school age children is abdomen that age is often ticklish or and children may be tense or guard their abdominal muscle when touched, making it difficult to palpate. The distract any child touch or masking. So unsa ano to siya, just like ani. So gipalpate niya o hinay-hinay ang abdomen sa children. So distract a child by asking questions about the home or school. So para di siya maka-feel og pain, so i-distract nato siya. So i-ask nato siya about sa iyang panimalay sa score or child place her hand under your hand to help to relax. So what is the genitorectal area? So for female genitalia, inspect the external and assessment in girls. So in American College of Obstetricians and Gynecologists alternate examinations consist of inspecting toner stage of pubic growth and configurations of kanang inverted the triangle, and you should expect when assessing the genitorectal is external genitalia, example the clitoris, the labia majora, and labia minore for the normal cortex. So look for the signs of discharge irritation. So for the male is the distribution and the tanner stage of pubic hair, which is the diamond shape. The penis for lesions that might be suggestion STI. Then appearance and placement of the urethral opening, which should not slit like a center of the penis to penis tip. So what is hypo hypopodias? So hypodias is means the urethral opening is located sa inferior or ventral under the surface of the penis. So what ang epispadias naman is denote the urethral opening. So urethral opening ni siya that on the superior or dorsal surface. So unsa na nato siya pag-assess? So i-inspect nato ang scrotum, that's the upper scrotum size and the presence of testes in the boys, that the testicle is slightly lower than right to the scrotum, does not appear but thoroughly symmetric. So ipalpate nato gawas na i-inspect. So ipalpate nato to check the both testes are present by placing on hand on the top of the scrotum for over the inguinal ring and then palpating the testes on the side. So a varicose is enlarged ni siya sa veins, which is epididymis ni siya. Maybe ipalpate nato that this is the most important findings para to know or sa pag-assess nato if ang young boys they could possibly interfere with fertility in later in life. So unsa man extremities? So extremities is observe upper extremities for good color, sa warmth, because changes in fingernails, so makita nato sa mga finger, sa mga kuko, sa can be sign to of overall health. So napuli sa extremities is makita nato ang kung if ever kung ang children is naa siya sakit, makita nato sa fingernails. So inspect them, the color, the contour, and the shape, that they should feel hard to touch but the brittle they break readily sign between of fingernails in the school age child may reflect a high level stress. So as you can see in the picture, so ingana siya. So the next is the back. When inspecting the back of the children when assessing, so you should inspect the back for symmetry and the spinal column. So as you can see, kuan siya, gipatuwad siya for column for any division. So gi-inspect ang base sa spinal or dermal sinus, pinpoint opening atop hair of hemangioma that might reveal spina bifida occulta that detect the bony structure of the canal. So when assessing the back of the children is assessed for tenderness, kung gahi ba ang ihang along sa spinal cord sa children, or by the use of palpate each vertebra, because chronic chronic lower back pain can be present early in school age. So, what is neurologic functions? Ang neurologic functions is examination takes 20 minutes to complete. So, this is not included in routine physical examination. So, next is the visual assessment. So, unsa man yung visual assessment? Visual assessment is uh, assessing children an important part of physical assessment, and because good vision is so important in childhood, the extent type of testing depends on the age. So during the assessment, so you should notice the unreported eye injury of infections that neglected in visions spatial notes. So, for vision screening, routine visions can begin in early, i-assess nato ni siya in vision screening from 6 to 12 month of age. So dapat ang mga parent is naga-provide og important clues to possible problem, or naga-careful sila anytime parent express concerns about sa mga questions and ability na if ever kung na siya matanawan about sa problem sa iyang vision screening siyang anak. So, newborn is should be able to focus on a moving object as finger and follow it so line. So, ang kanyang newborn panjud is di pa man sila ka-istorya no. So, magtan-aw pa na sila, musunod na kung sila. Example, kung nakay gidala na mga things na makanang tanaw nila na kaaya-aya siyang paningin, so ila nang sunod-sunodon og tanaw. So as parent, if infant eyes follow them as they move around the room, so naga-tanaw ba na imong anak sa room, the way pa na napa siya sa ospital. So the next is the toddler and preschooler. So the toddler and the preschooler ask parent if their children do anything of the following: kanang ginarab ba niya yang eyes, or blink, squint, or frown, kanang makakita ba siya by the use of one hand. Example ng ani, makakita ba siya by ba kanang sa isa lang kamata, tilt the head to seeing the better fat, holds books and toys extremely to close, extremely far away to look down. So paguniton mutanaw siya sa mga object na kanalay-lay siya. For the school age, childhood, adolescents report difficulty seeing, reports frequently headaches. Thus the poorly with class works, avoid sports that for school age. So if malisod yun na sila tanaw. So is magkakos if kung nakay problem sa eyes sa children is magkakos na siya illness or headache. So dapat dili na sila mo appeal, just like anang mga long distance vision such as basketball or softball. So dapat i-avoid nimo siya watching mga TVs, mga using gadgets. So report blurriness or double visions, history din conjunctive or strangeness from eyes, blinks are bright. So dapat i-report tayo na to na siya sa health worker, or magpa-check up din ta sa doctor for to assess them. So the next is these are the techniques of vision testing. So first is the Snellen chart, the Preschool chart, the National Society for the Preventive of Blindness home test, which is Allen cards, and Steicar cards. So the next is the Tismos Vision Center, which is vision color of awareness of testing, vision referral. So always screen children that before referring them to primary care providers. Testing twice helps eliminate to identify this type of smell lending results. So in hearing assessment, so for the newborn is hearing assessed through the sample response testing, observing whether an infant's responds to sounds delivered by the child with a commercial sound. So dapat obserbahan pa nato atong mga anak or ang infant kung naba siya response if ever kung magpa-sounds ta or mga something na mga things na kanang naay voice. So for the older is child who raised for hearing loss, those have been exposed to loud noises such as explosions or loud music, were of the low birth weight, have a congenital anomalies, have a referred grip, a palate of repeated for infection. So the next is principle of amniotic a geometric assessment. So, unsa man ni? So, the na siya 4, which is the frequency, loudness, hearing loss, acoustic impedance testing, and conduction's long testing. So, a speech assessment is a problem that directly related to hearing problems. So, problem ni siya, ang speech assessment is anang about ni siya sa hearing problem for infants na kanang dili makadungog will make probably bubbling sound that will develop intelligible speech. So because they can hear speech to report the difficulties related. So there are three under of speech assessment, which is motor development, cognitive development, and cultural development. So for the developmental appraisal, it would be ideal in children that it will demonstrate and development skills are capable every time that they are asked and demonstrate. However, they accomplish the infants is kanang gutom ba siya or sleepy ba siya or absent during testing. Older children may become shy o maulo ba ang children. So the next is the developmental history. Sa developmental history is presence ni siya sa carefully records for children that less carefully record for their secondary. So the next is the temperament. So temperament is refers a child initiative behavior characteristics such as actively living level and easy child of temperament and generally adaptable. So helping children assess their child's in temperament helps them in turn recognize their children for anticipate and to prevent personality conflicts that grows older and expressed in identify situations. So the next is immunization. So immunization is most important things in children that to assess and promote a measure for children to verify their immunizations is up to date. So teach parent about the importance of having their children immunization. So tudloan sa health worker, tudloan nato siya kung unsay benefits aning immunization sa children. Need to be able to describe the number and the type of immunization. So gawas ana i-explain nato ang number o ang type sa kung unsa ang gi-inject siyang anak for to know para dili malibog ang gini parents. So the next is types of immunization. So child immunization. So the diphtheria, tetanus and pertussis vaccine, the polio vaccine, the measles vaccines, the mumps and the rubella vaccines, the hepatitis B vaccines, the hepatitis A vaccines, the rotavirus vaccines, the Haemophilus influenza, Hep B vaccines. So the varicella vaccines, the pneumococcal pneumonia vaccines, the human papillomavirus, the meningococcal vaccines, the Lyme disease vaccines, and the influenza vaccines, and the last is the anthrax and smallpox vaccine. So the next is administrations, the way you administer immunization sa usa ka children. So muni ang dapat i-prepare to administration to be certain to follow manufacturers recommendation for stage and handling vaccines should be not expressed light or whether the vaccine. So children with unique needs, so children with naay mga chronic illness is maybe hospitalized for at that time of immunization, so due to fall behind schedule. So children who miss the scheduled time for immunization is do not need to have series of started over, but rather than should simply continue at the point of daily off. So the next is the administrations of immunization. So when preparing administrations for immunization of the children, so be certain to follow the manufacturers, the recommendations, and the storage of handling of vaccines that expose whether the vaccine. So the next is children unique needs. So this is the children that have a chronic illness that hospitalized at that time of immunizations that due to behind the children. So children who miss schedule for immunizations do not be have a series started of over rather should simple continue at that point that take off. So parental educations are a major reasons for parents do not do not do not um do not know that the required of having misconceptions about kuan. So dili man jud kalikayan no na jud mga misconceptions about sa immunization sa children. So dapat pasabton nila si ang as a health worker, so pasabton nato ang parents tagaan gyud nato sila reasons nga nang need og immunization sa ilang anak. So fully inform parents and when of enough children about what immunization I recommend. So dapat i-inform nato ang parents o kung before ta mag-immunize, so dapat i-inform nato ni na muni atong i-immunize iya ha for kanang for allergies ba, for polio ingana. So when vaccines are given, be certain parents know that is being given side effects may be expected. So dapat inundaan na to ang parents na ma'am kanang mura ba ni ang mga side effects ma'am kung human sa pag immunize imong anak ma'am. So aware na imuhang ang parents sa ginikanan about sa so makuanan na niya og medications matagaan maandaman na niya medications kung unsay side effect na mahitabo siyang anak. So make a copy of child immunization record for the parents and urge to keep good tracks of such records. So dapat tagaan at dili lang kita ang magunit as a health worker or sa or barangay health worker, dili lang kita ang magunit sa immunization card sa bata kundi pati ang ginikanan para makabalo sila na ing-ani na importante da ini para sila. So at a very maintenance visit, inform parents and the child as the child primary care provider to inform their depending agency policy and available resource sa screening procedure na gi-perform sa health worker. So as a health assessment is it reveals some health that concerns and follow-up procedures and plan the certain parents understand that reasons for the upcoming test, and also many providers patients that families can use to ask additional informations and immunization records. So that's all. Thank you. So this is the references, which is maternal and child healthcare nursing for care of childbearing and child-rearing family in 8th edition. So child health assessment, Joanne Salvert Flag and Adele Pelletri. So that's all. Thank you.